Chapter 17, Cognitive Impairment, Alzheimer's Disease, and Dementia. The most significant losses include slower response times and impaired short-term memory. When you're taking care of a patient that has this impaired memory, what we're going to do is we're going to give them more time to actually process, store, and retrieve information. What I mean is, if you're taking care of a patient that actually has that memory problem, you have to be more patient as the nurse taking care of them. You cannot be rushing them. You need to be that highly skilled listener. And then please remember that confusion is not normal. Okay, confusion is not normal. As a matter of fact, confusion is actually the first sign for us to start our investigation or further investigation when we actually see that the patient is confused. Okay, it's not normal part of aging. And then confusion demands investigation, like I just said. Maybe if you have a patient that started or there's a worsening confusion, then it's time to have the primary involved, psychiatric involved, and maybe we would like as nursing to do labs or collect the urine to actually rule out UTIs, because UTI can cause some confusion in some of the patients out there. The 5 Ds of confusion is damage. There's a damage to those brain cells, delirium, dementia, depression, and deprivation. There are many medications and drugs that can cause confusion, especially in older adults. And as a matter of fact, confusion is often the first sign of a drug reaction. So, what medications can actually cause confusion in older adults? There's some medications to treat allergies, like your antihistamines, right? And can cause them very lethargic and sleepy and maybe even a little confused. High blood pressure medications, irritable bowel syndrome medications for migraine, headache, pain, or Parkinson's disease. Okay, the difference between delirium and dementia. So delirium is a change in condition and consciousness that occurs quickly. Okay, occurs quickly. That's your keyword for your delirium. It may result in delusions and hallucinations, right? Delusions is a belief, right? A false belief of something else. And then hallucinations is when patients actually hearing something or hearing or seeing something that is not in there, that's not there in reality. It is reversible if it's treated early, and patient will have a full recovery of mental functions, especially if it's found and treated early. Okay, so that's why it's very important, because infection is um one of the biggest thing that actually could cause delirium for patients. It is important for healthcare providers to recognize the signs of delirium so that we can actually do something about it and do some interventions before it could actually progress into something more serious. So delirium is a reversible syndrome that comes on suddenly, right? That's your keyword, suddenly, usually as a result of a metabolic, nutritional, or toxic disorders. So, for example, your post-operative states, right? Some psychoactive substances, hypoxia is one too, hepatic or renal disease, maybe alcohol intoxication or withdrawal, and some head injuries also could cause this. Okay, dementia is a group of symptoms that relates to a severe loss of multiple abilities, including the memory, language, and the ability to understand and to think. There's some causes for dementia. One is your Alzheimer's disease, which is the primary, or it could be secondary as a result of another disease. Two most common types of dementia are vascular dementia and the Alzheimer's disease. Vascular dementia, this is caused by cardiovascular diseases in which not enough blood is nourishing the brain to keep it functioning properly. Unlike Alzheimer's disease, the course of vascular dementia may be characterized by ups and downs in behavior, and the box 17.2 can actually help you to see some possible more causes of dementia, and they gave us a mnemonic of MEND, MENDAMIND, and metabolic disorders, electrical or nerve disorders, neoplastic disease, degenerative disease, arterial disease, mechanical disorders, infectious disease, nutritional disorders, and drug toxicity. Okay, and then Alzheimer's disease, we'll go over that. Alzheimer's disease is a progressive degenerative disorder that affects the brain cells and results in impaired memory, thinking, and behavior. And that is the difference for the vascular dementia. For the vascular dementia, it's actually the blood flow and the blood vessels that's affected. In your Alzheimer's disease, this is a degenerative disorder that affects the brain cells. It's divided into two categories. It's early onset or late onset, depends on when the symptoms actually started and progressed. Early onset is before 65 years of age, and obviously late onset is after that. Alzheimer's disease is not a normal part of aging, like I said when I was talking about confusion, not a normal part of aging. And this is your keyword for your Alzheimer's disease, that it is gradual, it's progressive death of one's brain and its function. So we have stages of the Alzheimer's disease. It could be early, intermediate, severe, and end stage. And we need to know these four stages of Alzheimer's disease. Early stage, this is when there's a loss of recent memory, um, inability to learn, process information, and the patient cannot or is having trouble retain some information. There will be some language problems, and then you will have intermediate stage, which is there's an inability to recall any recent events or process new information. Severe stage is when there's an inability to do anything. Um, the patient can actually even forget how to eat, forget the basic, ADL activities. Um, and then you have the end stage, which is the coma and death. So yes, Alzheimer's disease is progressive, and it's a loss of memory and an ability to think, and some language problems. But when it gets to the progressive or the advanced stage, then it could actually cause coma and death, because the patient can even forget to swallow, can even forget the most basic needs that the body needs to actually survive. All right, therapeutic interventions. Therapeutic care for clients with Alzheimer's disease has three goals. You have to provide the client's safety and well-being. Okay, sorry, safety and well-being. You also want to manage the client's behaviors therapeutically, and you want to provide support for family, relatives, and caregivers. When the patient is behaving inappropriately, Patients are gently redirected to a less stressful activities. And what does it mean? Maybe you're taking care of a patient that has Alzheimer's disease, and they started to actually have some kind of behaviors or acting out. Make sure that you actually check and redirect the patient to a less um, stressful environment, or in an environment when there's a or where there's a less stimulus, so it can actually help to for the redirection of the patient. Caregiver support. So remember that this is also hard for the family members of those patients that actually has the Alzheimer's disease. This is most difficult, very difficult for all caregiving or caregivers or family members. Most individuals with Alzheimer's are cared for in the home by family, friends, and home care agencies. Although we can have, or they can have, informal support groups or formal support groups in the community. Informal are some other family members, friends, people at work, social groups, and faith communities. And formal support groups when the patient actually will be brought to home care agencies, or nursing home like elder care centers, and maybe even hospice. And that concludes chapter 17.